ashver.com.
Hello, welcome to ashver.com. You are watching an interesting video about bladder spasm, UTI symptoms without bacteria. Please read the disclaimer carefully. Urinary tract symptoms without bacteria. You go to the doctor with what you're sure is a bladder infection, only it's not. A urinalysis shows that there is no bacteria present. So what now? Antibiotics don't help, in fact they may make it worse. Often a doctor will prescribe antibiotics for UTI symptoms without performing a urinalysis. After what I have been through, I would recommend that you insist on a urinalysis before taking antibiotics for urinary symptoms. Many women find themselves in this situation at some point in their lives, and their GP or gynecologist must be very knowledgeable about it. Trying to get information about it, and treatment for it can be very frustrating. The urologist I went to called it simply bladder spasm, and he took great pains to explain to me how difficult it is to find the cause and the right treatment for these symptoms. He also said that many women have episodes of bladder spasm at some time in their lives, but recover from it completely. Through research, and trial and error, I found the things that worked for me. I now have been symptom-free for over a year and a half, and I am not taking any medication. The symptoms: urinary frequency, burning, pelvic pain and painful urination. In my experience, most doctors, especially male doctors, do not perceive these symptoms as a serious medical matter, certainly not an emergency. After all, your vital signs are all fine. An examination doesn't find anything amiss, nothing is showing up in your blood or urine, therefore, you're fine. It's easy to get overwhelmed and very emotional when this happens. You're extremely uncomfortable, and it's very hard to get any sleep. You're physically and emotionally frazzled, but try to get a grip on yourself. If you show up at a doctor's office in that condition, it will be even harder to be taken seriously. In fact, when I showed up at the ER in tears, I was prescribed Xanax by a doctor who obviously thought I was just hysterical. Also, the pain cycle can feed on itself, and the more emotionally worked up you get, the worse you may feel. Believe me, it will get better. Bladder First Aid. I'll get into more details later, but if you are suffering right now, this is what I would do. The first line of defense for me is to drink 1/4 teaspoon of baking soda, dissolved in a small amount of water. Do not exceed 2 teaspoons a day. This neutralizes the acid in your urine. In my case, I started feeling better within 10 minutes. I read about it in a book, and it helped me much more than anything any of the doctors I had been going to for months had. I found a hot bath to be very palliative. Try to relax your pelvic floor muscles as much as you can. You've probably been straining to empty your bladder as much as possible when you urinate. Try not to do that, it's making it worse. The muscles in that area are all tense and the nerves are overstimulated. It's the same muscle you work when doing Kegel exercises, but just locate that muscle by tightening it once, then consciously relax it. I was really surprised how much better this made me feel. Immediately stop consuming all carbonated drinks, alcohol, chocolate and coffee, and do not drink any cranberry juice, or other fruit juice. It is very acidic and will irritate your bladder. Many people with these symptoms have been drinking large quantities of cranberry juice. Stop doing that. Drink plenty of plain water, but do not force yourself to drink gallons, just drink a glass whenever you think about it. I really sabotaged myself for a while because I would not give up that 1 cup of coffee in the morning. Once I got past that, I started to get better. Milk or vanilla ice cream can be soothing. Make sure you get a brand of ice cream without a lot of... What's wrong with me? Could it be interstitial cystitis? If you are researching these symptoms on the internet, you may come across this term, or perhaps your doctor has mentioned it. Interstitial cystitis is a chronic inflammation of the lining of the bladder. If you have the symptoms I've been discussing, you probably have cystitis, which is bladder inflammation. If it doesn't go away, and no other cause can be found for it, then it may be interstitial cystitis. Interstitial cystitis is often mistaken for a urinary tract infection. Patients often go as long as 4 years between the time they first experience symptoms and the time they receive their diagnosis. It most commonly affects women, although men can get it too. It is diagnosed by ruling out other conditions, like bladder infections, or bladder cancer. Also, when it is advanced, there are visible ulcers on the lining of the bladder that can be seen by cystoscopy. Once your GP recognizes that you don't have a garden variety bladder infection, you will probably be referred to a urologist. All of this takes time, and it will likely be a couple of months before you actually see the urologist. Usually the first thing he will want to do is a cystoscopy, in which a tube with a camera on the end of it is inserted through the urethra into the bladder to examine it. My urologist made an appointment for me to have that test, but it was 6 weeks away. He said that if I got better before then, I should call and cancel. The idea of that test really freaked me out, especially given the way I was feeling. Reading the interstitial cystitis forums I found online, I wasn't very encouraged as far as what I could expect after the test. I didn't really see a lot of positive comments about how great things were after the diagnosis. Everyone seemed to be on a lot of drugs that were marginally effective at controlling their symptoms, and it sounded like a life sentence to me. One of those conditions you just have to live with. Now, looking back, I think most people who get over their problems never go back to the forum to share their story, so just because you don't see many success stories doesn't mean they don't exist. I did get some good advice for dietary changes and supplements from the Interstitial Cystitis forum, but I've tried to condense it here to give easier access to someone who reads this while having a first experience with bladder irritation. I never did have the cystoscopy. I was able to get my symptoms under control and opted not to have it. The cause of interstitial cystitis is rather mysterious, and I was never diagnosed with it, but I feel like if I had continued to irritate my bladder, maybe I could have developed this chronic condition. From my reading and research, it sounds like it's important to get your symptoms under control early. Dietary changes when you first experience symptoms can prevent your condition from progressing. Patients who have had it for a long period of time experience less relief from dietary changes. If, despite your best effort, you don't get better, by all means have the test. If it turns out you do have interstitial cystitis, healing an irritated bladder, what worked for me? The healthy bladder is coated with a mucosal tissue called the glycosaminoglycan layer, generally referred to as the GAG layer. This layer protects the bladder from direct contact with the urine that it contains. This layer can become damaged by bacteria, or for other reasons. I went on a regimen designed to heal the GAG layer. First of all, go on a low-acid diet. If you look up interstitial cystitis diet or IC diet, you will get a lot of varying advice on this. Different people seem to have different triggers. The ones I mentioned above in the Bladder First Aid section are common offenders, and most of them definitely affected me. One book I read said, if you wouldn't put it on an open wound, don't eat it, and this resonated with me. So things like hot spices, lemon and vinegar would be off limits. If I ate acidic food, I could feel it within 10 minutes, burning my bladder. What to eat? It can be hard. With just a list of things you can't have to figure out what to eat. There are plenty of foods you can still eat. Any meat, poultry, fish or shellfish is okay except cured meats like bacon or salami. Most vegetables other than tomatoes or hot peppers are fine. You can still eat bread, other than rye and sourdough. Dairy foods including milk, butter, cottage cheese, American cheese and vanilla ice cream work. You can start adding some of the milder aged cheeses in small amounts once you start feeling better. Pasta, rice and most cereals are okay. Salads can be a problem because of the dressing, but you can have them with olive oil and garlic. When you feel better, start slowly adding foods one at a time. It can be tempting to just go back to your regular eating pattern, but you don't want to have to stop. I started with a little mayonnaise on my sandwich because I really missed it. Based on what I read in books and researched on the internet, I use the supplements and products listed below. Glucosamine and chondroitin 400 mg 3x per day, it coats the gag layer and gives it a chance to heal. Calcium citrate plus vitamin D 200 mg 2x per day, it helps your body excrete oxalates more efficiently. This helps prevent vulvodynia, an associated condition which is also very unpleasant. Bromelain 100 GDU 3x per day, anti-inflammatory. Quercetin 100 mg 3x per day, anti-inflammatory. Preleaf is an antacid that you can take before eating acidic foods. I would not recommend eating acidic foods, even with it, until you get your symptoms somewhat under control. But I did use it occasionally if I needed to eat out, as a precautionary measure, and more often as my bladder improved and I was able to eat a more normal diet. You might want to start off with the glucosamine and chondroitin, and work your way down the list, adding one supplement at a time and waiting a few days before adding the next one, just to make sure it's not a trigger for you. One prescription medication I took for a short time that did help me was ditropan. At first I was taking 5 mg a day and it wasn't helping, but my doctor raised it to 10 mg and it gave me some. This is based on my personal experience. I am not a medical professional. I only want to share my experience in the hope that it helps someone else who is going through this. Every person and every bladder is different. What worked for me may not work for you. If it doesn't, don't give up, keep trying until you find something that does. If you're really suffering right now, you're probably having a flare. It won't last forever, it will pass. It will take time for your bladder to heal, so don't expect a miracle cure overnight. I have experienced 2 flares that lasted several months each. I am able to eat a normal diet now, eat coffee and chocolate. But if I had to give them up forever to prevent that kind of pain, it would be well worth it, and if that feeling comes back, I know what I have to do. Thank you for watching this video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find lot of interesting videos on wide range of topics here. Stay tuned and keep watching.